GC has recently developed an even stronger posterior glass ionomer, which soon will be released. The instructions for use include expanded uses in Class 1 and in Class 2 materials. This is a restoration that I placed last week using the new, stronger Equia Forte in the lower second molar in this IMO restoration. You may say, well, why did you choose to place glass ionomer in this situation rather than the composite, which I did on the tooth in front of it at the same time? And the answer was that the decay went very, very far subgingival, and that it went onto dentin, and it was very close to the pulp when I removed all the decay. My concern was that perhaps there would be a lot of postoperative sensitivity in the situation. I also used it because it was very simple to use. I first placed that restoration as a bulk fill material, allowed it to set up for the 2.5 minutes, did my shaping, placed my surface sealant, and then I went ahead and used my sectional matrix and placed my composite restoration. I also like the fact that I've got that fluoride that is in that interproximal area between both of those teeth, which can be very beneficial. In summary, I'm a big believer of glass ionomer materials. It's a material that I could not practice without. Glass ionomers are the missing link of aesthetic materials. They are smart, they are bioactive, and they are biomimetic. Glass ionomers are right on target for our older patients who have the dry mouth, who have the root caries, who have a difficult time in maintaining good oral hygiene, who can't sit for long appointments, for long crown appointments any longer, and who may not have the finances to go ahead and do a crown as we would wish that they would do. They're on target for our younger patients, especially all of our younger patients who seem to consume vast amounts of soft drinks and of energy drinks. The situation with people drinking so much bottled water now, and unfortunately many of these do not contain fluoride. They're very useful for our young patients who unfortunately develop some bad habits and do not take good care of their mouths. They're on target for all patients. They're quick and easy. You talk about bulk fill, which is very popular now and I like to use on a number of situations. These are the original bulk fill materials. They're more affordable for many of our patients. They work so well with long-term interim restoration. It's funny. The more of these long-term interim restorations that I place, the more I'm surprised how they come back at 2, 3, 4, 5, 8 years and how they still are servicing the patient well. They help to keep people's teeth, ultimately, if that's what we're all trying to accomplish. So to put glass ionomers in proper perspective, certainly composite is still the main direct restorative material that I use and that most people use. Certainly ceramics, the main indirect restorative material that are used. But when I want to stay with aesthetic materials, glass ionomers are something, the missing link, something I can't do without. I run into so many situations where a composite would not be appropriate, and they help me to help my patients keep their teeth. I want to thank you for this opportunity to share my feelings and my passion about glass ionomers.